The autonomic nervous system is a network of nerves that regulate unconscious body processes. The autonomic system is part of the peripheral nervous system, responsible for regulating involuntary body functions such as heartbeat, blood flow, breathing, and digestion. Because of this, the autonomic nervous system is also sometimes known as the involuntary nervous system. This system is further divided into three branches: the sympathetic system, the parasympathetic system, and the enteric nervous system. Firstly, the parasympathetic nervous system. This is part of the autonomic nervous system, which helps to maintain normal body functions and it conserves physical resources. This division also performs tasks such as controlling the bladder, slowing heart rate, and constricting the eye pupils. Secondly, the sympathetic nervous system. This is a division that regulates the flight or fight responses. The sympathetic system also performs tasks such as relaxing the bladder, speeding up heart rate, and dilating the pupils. Then finally, the enteric nervous system. This is part of the autonomic nervous system that controls the gastrointestinal tract and the digestion of food. So, how does the autonomic nervous system work? The autonomic nervous system operates by receiving information from the environment and from other parts of the body. The sympathetic and the parasympathetic system tends to have opposing action, in which one system will trigger a response while the other tends to inhibit the response. So traditionally, stimulation has been thought to take place through the sympathetic system, while inhibition was thought to occur via the parasympathetic system. However, there are many exceptions that have been found. So in today's study, we can say the sympathetic system is viewed as a quickly responding system that will mobilize the body for action, while the parasympathetic system, on the other hand, is believed to act in such a way that it slows or it dampens the responses from the sympathetic system. So for example, the sympathetic nervous system will act to raise blood pressure, while the parasympathetic system tends to lower blood pressure. So we can say the two systems actually work together to manage the body's responses depending on the situation and the need. So if, for example, you are facing a threat or you need to flee, the sympathetic system will quickly mobilize your body to take action. And then once the threat has passed, the parasympathetic system actually kicks in and it starts to dampen those responses, returning your body into a normal and resting state. So let's talk about the functions of the autonomic nervous system. So internal organ regulation by the autonomic system include the heart, the blood vessels, the stomach, the intestine, the liver, bladder, lungs, the pupils, the genitals, digestive glands, and the kidneys. The autonomic system controls a variety of internal processes. It includes the blood pressure, the body temperature, breathing rate, circulatory system, digestion, electrolyte balance, emotional responses, glands of the mouth, the nose, and the eyes, the immune system, our heart rates, our liver function, metabolism, pancreas function, pupillary response, production of body fluids including sweat and saliva, and also sexual responses. So now let's talk about the neurotransmitters in the autonomic nervous system. The autonomic nerve pathways connect different organs to the brainstem or the spinal cord. There are also two key neurotransmitters, or you can call them chemical messengers. Firstly, we have acetylcholine. It is often used by the parasympathetic system to help inhibit effects, while the norepinephrine often works within the sympathetic system to have a stimulating effect on the body. Now, what are the autonomic disorders? When the parasympathetic and the sympathetic components of the nervous system become out of sync, which is they lose their balance, people can experience an autonomic disorder, and this is called dysautonomia. So this can actually be an exam question, and it is important to note down. Now, there are numerous types of autonomic disorders, and each has its own unique set of symptoms. So firstly, we have acute autonomic paralysis. Now, this condition is also known as the autonomic dysplasia. It is caused by injury to the spinal cord in the lower upper back, leading to dangerous high blood pressure and low heart rate. Then secondly, we have the afferent baroreflex failure. Now, this is actually a rare condition that leads to shift in blood pressure and heart rate, which may include episodes of severe hypertension. And then we also have multiple system atrophy. We have osteostatic hypotension and then postprandial hypotension. Now, sometimes these disorders can actually just occur alone, but most times it is caused by other conditions that disrupt the autonomic nervous system. And this include aging, alcohol or drug use, autoimmune disease, cancers, chronic fatigue syndrome, diabetes, Parkinson's disease, spinal cord disorders, and finally, trauma. So, a little recap. Damage to the nervous system can be caused by chronic health conditions, drugs, aging, infection, or traumatic injury. So this is actually the end of this video. All you have to know is that the autonomic nervous system is basically a system that controls the body without us knowing. So in other words, it is the involuntary part of the nervous system. It controls our blood flow, digestion, and also our heart beats. Thanks for watching. If you found this video helpful, kindly subscribe for more videos and also like the video so the algorithm gets to show it to other medical students. Thanks for watching as always, and see you in the next one.